Look guys, it is common knowledge to know that Americans are dumb, fat, gun-loving fanatics that lack universal healthcare. Unless you live under a rock, you probably already knew it as a fact. I know it, Joe knows it, Candace knows it, the Turkish kebab owner knows it, the Somali pirate knows it. Everybody knows about it. It is literally a fact. I repeat, a fact, not an opinion. Well, except for those who are on the right, mainly Republican people and conservative pundits that spew a lot of nonsense like this.
Healthcare is not a right. Healthcare is a commodity. And the difference between those two views is that if you think healthcare is a right, now you're going to use the government to cram down on doctors that they must serve you at a particular price, or cram down on taxpayers that they have to pay for a certain level of your care, or cram down on insurance companies that they can't be insurance companies anymore. They have to be health coverage institutes, essentially.
Whew. I have no words. Last week in last video, I talked about a no-nonsense plan pushed by Bernie Sanders and Elizabeth Warren called
Medicare for All.
And despite the best attempts to implement that healthcare model, there's a lot of resistance, mainly by people on the right that adore the status quo. Remember, healthcare is a privilege, not a right. I repeat, healthcare is a privilege, not a right. All those freeloaders over there, they don't deserve healthcare at all. But the left, they see, oh my gosh, Aunt Betty, she has to resort to go on GoFundMe to fund her medical expenses. This is unacceptable! Something needs to change. And when you have like two different political parties that want two different things, you go nowhere. You stand still, and every like 2 to 4 years, we hear about the issue, then it dies out. It wasn't until Trump came into office once again in January that there was this one act that was signed, the Laken-Riley Act. Looking at the act, honestly speaking, it is one of the toughest crime immigration bill out there.
The Republican-led House has passed the Laken-Riley Act, a strict immigration detention bill named for a 22-year-old Georgia nursing student murdered last year by an undocumented immigrant. The legislation targets undocumented individuals who commit crimes and is expected to become the first bill signed into law by President Trump in his second term.
No one will say the contrary, but if you actually look at it, I want to take a look at the time frame between the murder of that young American girl up until the point of the signature. It took 3 years. And the most surprising thing is that the Republicans and the Democrats came together and signed that bill. I was like, what? You guys can come together and sign a bill? Why aren't you doing that for healthcare? Afterwards, I started doing my researches, and after watching a lot of videos comparing the United States healthcare system compared to other countries and doing a lot of researches on my own, I came up with 4 healthcare models that the United States can inspire itself from. And we're gonna be talking about the 4 countries of Germany, Switzerland, Canada, and the UK. Without further ado, let's start the video. Guten Tag, guys. For the first country, we're going to Germany. Germany, home to the Autobahn, Pretzels, Bundesliga, and the Kraken. Okay, you know what? I'm not going to attempt to say it. Google.
Gesetzliche Krankenversicherung.
Yeah, that word right there is a social insurance program that covers German citizens, PR citizens, refugees, long-term residents, aliens, everybody that resides long-term in Germany, with the exceptions of undocumented migrants.
Mr. Mamakayev, we're on our way to the court. The judge will decide whether you will go into deportation, detention, or custody.
And visitors, y'all are not covered though. The social insurance program that they have in Germany is funded through social contributions. When you receive your income from work, you obviously have to pay taxes. And when you look at the income statement, you will realize something. You pay something called the social contribution that everyone is required to pay. It is around 15% of your income, and the cost is evenly split between your employer and you. What happens if you are self-employed? Do you pay half the cost? And the answer is surprisingly no. You're gonna have to bear the whole cost. For those that happen to be, like Americans like to call it, freeloaders, which are the low-income people, the pensioners, etc., the government covered the tab. Honestly speaking, that program is really successful. Almost 95% people residing in Germany are covered by that program. Almost everyone. And for the people that are not covered, unfortunately, it's not the low-income people. It's mostly rich people that tend to opt out. It's mainly famous athletes, like footballers. If you're rich enough, you can opt out of the system, and the system allows you to do so. And if you happen to be in the system, the out-of-pocket costs are really minimum. Doctor visits, hospital stays, medicine is really cheap. It costs little to nothing. And unfortunately, compared to Medicare for All, vision and dental are usually not covered, but people tend to have additional insurance. What is the government role in the system? The government caps out-of-pocket costs, and they also determine who runs the system. And one thing you will realize in Germany is that the government does not run hospitals and pharmacies and medical facilities, contrary to popular belief. It's all privatized. There's obviously pros and cons in the system. One major pro is it's not financed through taxation. So if you have a right-wing government, you're not in fear of your health care for the common German to be slashed, and you have a wide variety of doctors and medical personnel and also insurance companies. But the cons is that the higher earner people tend to opt out of the system, which can really be a strain. It puts the burden onto lower income people. It risks not having enough funding to cover everyone. Now we go to a neighboring country of Germany, Switzerland. One of the richest countries in Europe. There's this one Swiss proverb that says, whoever lives in Switzerland is required to have health insurance. If not, we will call your parents. With that being said, funding of the healthcare premiums is really similar to how the healthcare system works in the United States. It's fully privatized. The government does not intervene in the healthcare system one way or the other. That results having the monthly premiums set by the insurance companies, and it's all by the individuals. And unfortunately, unlike in Germany, it is not income-based. So the poorer you are, the more it puts a strain onto you. If you happen to be poor enough, the government will subsidize the premiums for you. With a fully privatized system, it obviously comes with a wide variety of choices. There are over 60 providers to choose from. Unfortunately, just like Obamacare, they cannot deny anyone with any pre-existing conditions. With that grand variety of choices, it also means that you can switch from one insurance provider to another as much as you want, but there is one catch. You can only switch insurance providers once every year. The 60 plans that you can choose from are usually primary care coverage. Although if you want some secondary care like dental, vision, you would have to spend more money to get additional insurance to cover that for you. The premium cost, it varies from person to person, from their age, the canton that they live in, their lifestyle choices. Typically, for an adult, it would cost about 300 to 500 Swiss francs per month, which is considerably cheaper compared to what Americans are paying.
I got a $14,000 ER bill for just being there for 3 hours. $14,000.
For kids, it typically is much lower, around 100, 200 francs per month. Now, the $1 million question is there any additional payments, aka co-payments? And the answer is yes. It typically is 10% of any further cost. For example, a hospital stay will cost around 15 Swiss francs per day, and they typically cap the price after 1 month. And what is the role of the government? First of all, they don't run the system. They determine what the insurance provider can and cannot do, such as the premium costs, mandatory enrollment, and who is covered or not. And they also help low-income people as well. There's obviously pros and cons with the system. The one major pro is that there's a wide variety of providers that you can choose from. Excellent care. Funny enough, Switzerland ranks high in healthcare quality, and it's really fast and innovative. Unfortunately, there are obviously some inconvenience. First major inconvenience is the premium cost. When you're poor, the burden of the premiums are way more higher. It can result being very expensive to a lot of people. Next country on our list is Canada, Canada, famous for having poutine, lumberjacks, and having a polite society. Canada is recognized by its politeness and its kindness, that they are kind enough to offer universal health care to everybody residing in their territory. And one thing that is very special about the system is it is publicly funded but privately delivered. Each province and territory are responsible for administrating their own healthcare. There's obviously a standard governed by the Canada Health Act. It stipulates that there's a certain amount of care that has to be funded for free, and the rest, it's up to the province to determine if it's financed or not. To recap, there is no insurance provider. The province that is the sole and only provider out there. RAMQ in Quebec, AHS in Alberta, BC Health in British Columbia, so on and so forth. Like I said, it covers everybody that resides legally in the territory, except for illegal immigrants and visitors. The funding of the system comes through taxation, and a portion of those taxes goes to a lump sum, and the government of Canada allocate a set amount of money to each provinces, and they deliver the healthcare. Unfortunately, not everything is covered, mainly dental, vision, physiotherapy, ambulances, mental health. Depending on which province you are in, it may or may not be covered. For example, here in Alberta, dental, vision, ambulances are not covered by AHS, and typically what people would do is get an additional insurance coverage through their job, such as Blue Cross, Sun Life, to provide them coverage. Now, the $1 million question is there any wait times? And the answer is surprisingly yes. But there's a catch. I'm not going to give the win to the conservative out there that say Canada has huge amount of wait time. They are true, but it is very misleading. The wait time that you commonly see out there are usually for non-emergency care and surgeries, but the wait times are considerably faster for cancer treatments and emergencies. There's obviously pros and cons with the Canadian model. One major pro is that you receive no bill. It costs $0 if you go walk in a clinic. It's actually illegal. No bills at all. And they have high quality care. The major inconvenience is the wait time. You have to wait a long time if you want secondary care due to the fact that the system forbids insurances to provide primary care privately. Many people are forced to wait, or they just go abroad. Now, for our next country, we're going back to Europe. We're going up north, and we're going to a country which has God Save Our Queen in the national anthem. And I'm talking about the United Kingdom of Great Britain and Northern Ireland. God Save the Queen. What's really amazing about the United Kingdom is that the government runs the national health system, NHS, and it covers everybody that is in the territory. And the thing is, everybody that works for the NHS, doctors, nurses, ambulance personnel, are all government workers. The whole system is government run. There's no wiggle room for insurance providers for the private system. It's all government run. In the UK, each countries have their own versions of NHS, NHS England, NHS Scotland, and in Northern Ireland, they have a different name, but essentially it's the same thing, NHS, but just under a different name. Since the whole system is fully government run, it obviously comes out of the taxpayer's bill. So the whole system is funded through taxation. The really surprising thing about NHS is that the coverage covers primary and secondary care, and there is no bill at the end. No bill at all. The only bill that you might see is mainly for medicine, and even then, it's dirt cheap. Obviously, with a government-run system, it obviously comes with its fair bit of issue. One major issue out there is the wait time. The wait time is considerably longer compared to a lot of other countries. The wait time is considerably long for mental health care and surgeries, but it's quite shorter for cancer treatment and emergency care. There's obviously pros and cons in NHS. One major advantage is that you get no bill at the end. $0 at the end. The best thing is everyone is covered. If you're in the UK, you're covered. There's obviously some cons on the system. One major inconvenience is the wait times, like I said. The second inconvenience is the funding depends on who's in charge. If a conservative is in charge, they tend to slash the NHS funding. And the third inconvenience is that there is a shortage of nurses and doctors.
A report published earlier said the NHS in England needs a big push of domestic doctors, nurses and health workers to dodge a recruitment crisis. As per an internal document accessed by the Guardian newspaper, the NHS will face staff shortages of up to 571,000 personnel by 2036. Currently, the NHS in England is already operating with a shortage of 154,000 staff members. The document, which is under a ministerial review, aims to end the NHS understaffing crisis that's been hovering over the department for many years.
So the rare nurses that are working in the healthcare system are mainly overworked and underpaid. In conclusion, we looked at 4 different healthcare models. $1 million question is, which healthcare model is the best for the US? In my opinion, I believe the Swiss model is the best model that the United States can implement. And the reason is, if you had to compare to the Canadian and British model, it will leave no room for the insurance providers. And in the US, the insurance providers have a big role in the healthcare system in the US. So having them put to the side is not really realistic to me. I was really hesitating between the German model and the Swiss model, but I ended up opting for the Swiss model because it is privately paid by the individual instead of the individual and the employer. And if you were to adopt the German model, it would probably result in higher taxation, and a lot of people on the right are against higher taxes. So I went with the Swiss model. It is very innovative, offers a wide variety of choices. Choices were a big concern to many Americans.
When I hear that healthcare is a right, what I hear is healthcare will no longer have choices.
Under Medicare for All, your choice of health coverage disappears.
Americans are still Americans. We're not socialists, we're not communists, we like choice. And we like to have choice in healthcare, especially.
Right. Wait times is negligible, is little to none. The healthcare premiums are fairly cheap. The insurance providers, they make money and they don't have to fire a lot of their personnel, resulting in a lot of job losses. Medicare for All was a really hot topic in terms of job losses. We estimated that 1.8 million people were expected to lose their job. Although it is a good plan, convincing 1.8 million people to lose their livelihood does not sit well with a lot of people, even though it is a good plan for the grand majority of Americans. So they get to keep their job, insurance providers get to make their money. But the biggest con, I would say, is insurance providers are probably gonna lose a lot of money because they have to accept people from pre-existing conditions. The premiums are capped by the government, and there's a lot of regulations, and it might result in insurance companies losing a ton of business, thus reducing reducing their amount of profits, and it's probably not gonna sit well with a lot of CEOs and shareholders. So those are my biggest concerns. But it's not like in the US there's not regulations. The first regulation is when Obamacare was passed in 2010, insurance providers cannot deny people with pre-existing conditions. And there's this one thing that was passed about 3 years ago called the No Surprise Act.
When they receive treatment from doctors and hospitals that are not in their insurance networks and that they did not choose. Consumers will be responsible only for their in-network cost sharing in these situations. Patients will also not be in the middle of billing disputes between providers and insurers.
It was a bipartisan bill. One big challenge to implement the Swiss model is the amount of influence that pharmaceutical companies and insurance companies have in the government and the ignorance of many Americans. A lot of Americans tend to think that if something is government run, it's gonna be very inefficient. And to be fair, I do get them, but there is some nuance to it. And if they decide to learn, they would realize that a lot of countries, their healthcare is basically private, it's just publicly funded. So, do I see it happening in the short term? Not really, but long term, maybe, especially with the Riley-Laken Act. If it took 3 years, nothing is impossible. 200 years ago, slavery was still a thing, and now it's completely unacceptable, illegal. So in the distant future, could it be possible? Possible, but in the short future, really unlikely, especially with the polarization in politics. For the common American that is stuck with terrible healthcare, my best shot is try to go abroad, get yourself a second citizenship, and then when you get sick, you just fly to the other country, get your healthcare that you need, then fly back. My other solution is try to find community clinic, charity hospitals that offer cheap healthcare. Last but not least, try to negotiate your bill with your insurance provider and the hospital. Frankly, a lot of people manage to negotiate bills and get their bill reduced. So those are my 3 best shots for now. I really hope that something can be done with their healthcare system in the US because it is bananas. With that being said, this is the end of the video. Thank you for watching. It has been a pleasure to make. We will see you next time. Cheers.